definitely has impacted in some areas the role of surgery. For example, you mentioned the PARP inhibitor in ovarian cancer. There was data that came out in, I think it was ASCO of last year, that looked at the benefit of doing a secondary cytoreductive surgery. This is not actually related to PARP, this is related to bevacizumab, but and we can get into that at a different point, but there was a question of whether or not secondary cytoreductive surgery would be beneficial in recurrent ovarian cancer. And although the data hasn't been published yet, basically it determined that secondary cytoreduction in the setting of patients who receive chemotherapy, especially with Bev, does not improve outcomes. So that just almost completely took away that whole field of secondary cytoreductive surgery. Not completely, we could talk about it in more detail, but that definitely impacted it. There was also some data, I think in ASCO of 2019, looking at treatment of recurrent ovarian cancer with PARP inhibitors specifically, where it's so effective that in BRCA patients, the role of secondary cytoreduction can certainly be negligible given the efficacy of the PARP inhibitors in those settings. So that's one example. I think targeted therapies definitely impact the surgery. The more efficacious the chemotherapies, the less aggressive surgical intervention we have to do. Not only targeted therapies, we have other areas of gynecologic cancer that the surgery has been impacted. For example, in ovarian cancer, looking at the surgery, the timing of the surgery for ovarian cancer, whether the surgery is done at the initial time or is done after a couple cycles of chemotherapy, which is called neoadjuvant chemotherapy followed by an interval surgical cytoreductive surgery. And basically it determined, and again, there's a lot of nuances to this, but giving chemotherapy first in order to decrease the tumor burden, followed by an interval surgery, showed equivalent outcomes to patients who had upfront surgical debulking, yet these patients ended up with a significantly less aggressive surgery, less morbidity, less mortality, and improved outcomes.